So you all requested anatomy class a lot. That's why we're conducting anatomy class. So today is just an introductory class, nothing much. It's just the basic terminology of anatomy, what you need to know. So let's start our class. So first of all, we all need to know what is anatomy. Okay, so the science which deals with the structural organization of living beings is called anatomy. Like all of the structures, where what is present in our body, how it is present, in which position it is present, all of these things are explained in anatomy. Anatomy, like to know anatomy is so essential and important for everything, like all of the subjects, whatever subject you read, even in future, whole of your life, you will need anatomy. And these basics, whatever I'm going to teach you today in class, are very important to like understand anything, like any viscera, any bone, just anything you will need these terminology to understand. So the basic structural organization of the body is known as anatomy. And the word anatom, it's actually a Greek word, and it means to cut up, okay, to cut up or make any sections. So that means anatom. And dissection means like equivalent. So in your when you will go to college, you will like perform dissection on the body, like on the cadaver, that is a dead body. You will perform dissection, you will like see muscles and skin and other things. So that's dissection. Yes, next slide please. Now there are some subdivisions of anatomy. So first one is cadaveric anatomy, the structures which are studied upon dissection. So cadaver, as you all know, the dead body that is present in the laboratories, that is present in the anatomy labs, is called cadaver. And that the study of the structures, what we do on the cadaver, is called like the cadaveric anatomy. So you can see the macroscopic and microscopic structures by this anatomy. Like you will dissect the cadaver in many planes, in many sections, and you will see the macroscopic structures, the gross structures, and also the microscopic structures like artery, vein, many things are visible. So moving on to the next slide. So there are some sections of the cadaveric anatomy. This is regional anatomy, systemic anatomy, cross-sectional anatomy. Regional anatomy means dividing the body based on regions. Okay, like head, neck is one region. Trunk or torso means which contains the thorax and the abdomen. Together it's called trunk or torso. And also pelvis is there. And then upper limb, lower limb. So this is the regional anatomy, like dividing the body or subdividing the body according to the regions, like the limbs, the upper limb, and the upper limb means the hands, the forearm, arm, and the palm, all these like upper limb. And then lower limb is like the thighs, the legs, and the feet. So these are basic like language, but in anatomy everything is different. Anatomical language is different. Okay, what we use in our regular life, we will not use that in medical, we will not use that language in anatomy. So now you will know what is anatomical language. So this is regional anatomy. And systemic anatomy, it is dissecting the body according to the systems of the body. So you know there are many systems present in our body. Even we have a slide that will discuss the systems of our body. That is the alimentary system, or the gastrointestinal tract is the alimentary system, which contains of the mouth, the esophagus, the stomach, okay, rectum. This is the alimentary canal. And then respiratory system, it consists of the trachea, the lungs, the bronchus, all these things. And then cardiovascular system is the heart, artery, vein, all these things. So dividing the body or dissecting the body based upon the systems is called the systemic anatomy. And then cross-sectional anatomy is the sections of the body are studied here. So we will study further, like many sections are present, like horizontal plane, vertical plane, sagittal plane, so many planes, coronal plane. All these planes you will know later on. So next slide, please. Now, what is living anatomy? The study of the structures on a living being by inspection, palpation, and auscultation is called living anatomy. So when we like check a patient, when you're going to be a doctor and you are going to check a patient, so something is wrong. Yes, Mariam, cross section is along planes, like according to sections. You will cut up the body in many sections, and then you will like see the inside anatomical structures, what are present, how it is present. So that is cross sectional, to cut up the body in many sections. Now, living anatomy, this is practice on patient, like the doctors will bilateral cutting is dissection, not always bilateral cutting is dissection. Like you will, when you're dissecting an arm, that's not bilateral cutting, like you're just dissecting the arm, whatever thing you are like wanting to see, what structure you're wanting to see, you will only dissect there, right? So it will depend on the situation. So you will learn all of these things when you go to the anatomy lab. Like there are many different ways how you can dissect a body. We'll just either dissect a limb to see the muscles present there, to see the arteries present there, like that. So living anatomy is practiced on patient. The doctors will like take the patient and they will see, inspect the patient, and they will touch and feel what is going on inside the body. Is everything okay or not? So these some things are called inspection, palpation, auscultation. By this you will see the structures of the living body. And then developmental anatomy means embryology. It is just basically the study of a fetus, like when from prenatal life, that is when the zygote is formed after fertilization, how that zygote is further develops into like it's the cells divide and it becomes a fetus, a small day 13 embryo, and then day 14 embryo, how it develops to be a complete like human being. That is embryology. Auscultation is just like when you place the stethoscope in the body and you hear the sounds. Like stethoscope is not only just placed on the heart to hear the heartbeat, it is also placed on the abdomen to see if any like abnormal sounds are present. So auscultation is like just hearing what is going inside by the stethoscope. That is auscultation or auscultating. Did you understand? Okay, I hope you all understood. So now microscopic anatomy or histology. Okay, histology is very important. This is like studying the tissues of the body under the microscope. So in histology or in histology lab, you will understand like what you will see. Like you will take a tissue from the body or any sample from the body, and you will place it under the microscope, and you will see the microscopic structures. What are the microscopic structures? Like you will see the cells, the nucleus, okay, how the cytoplasm is, how the epithelium is, okay, the basement membrane, everything, whatever is normal, abnormal, you will study all these things under the microscope, and that is called histology. Like microscopic anatomical study is histology, studying all the tissues, cells, everything under microscope. So you will, in your histology lab, they will give you like slides with tissue samples, and you will see it under the microscope. You will then understand how the cytoplasm looks, how nucleus looks, and then you will stay in it. There are so many procedures. So in measuring BP, you will do auscultation, right? Stethoscope is placed, and then you hear the beats, right? In measuring blood pressure, without hearing, how will you measure blood pressure? So auscultation is necessary. Yes, in measuring blood pressure, auscultation is done. Okay, so next is surface anatomy or surface anatomy. Other name is topography, like studying the internal organs or studying like the whole structure of the body, like surface, from a surface point of view. Like this is done on a living body. Like you will, a person will sit in front of you, and you will like see that person and mark the body outer external structures and see the surface anatomy, like surface structures of the body, whatever is outside. And you will practice this in your anatomy lab, like anatomy classes. You will practice surface anatomy on a living person. Like your colleges will arrange a living person for you, and you will like practice the surface anatomy on them. Palpation means like feeling, like you will place the patient is lying down, and you will press and feel like whenever there is like a stomach pain or liver, something is wrong, like whenever you go to a doctor, you see that the doctor feels and sees the area where you're having problem, right? They palpate that area to see what is going on. So that is palpation, like just to feel that area to see any abnormality. Yes, BP is checked using both palpation, auscultation, you're right. Yes, you will study in a living person, like there will be a person, you will practice surface anatomy, and then you will see x-rays, so many things. Anatomy is a very interesting subject, and clearing basics of anatomy is so important for like whole of your MBBS life. So next slide, please. Now, what is radiographic anatomy? Or like this is like imaging anatomy, like this is just basically studying x-rays. That is radiographic anatomy. So in your colleges there will be like a machine, x-ray machine, and you will some x-rays will be given to you, like plantar, like some joints, maybe hip joint, pelvic joint, okay, like x-ray of the foot, x-ray of the hand, and then x-ray of the KUB, kidney urinary bladder region. So some x-rays will be prepared for you, and then in the exams you will have to place that x-ray under the machine, and you will have to see it and explain it to the teacher what you are seeing in that x-ray. Okay, is there any abnormality or not, and everything is normal or not in that x-ray, you will have to explain it to the teacher. So you will learn all of this. This portion of anatomy is called radiographic anatomy. Okay, imaging anatomy. So you will studying of the x-ray or the ultrasonogram, CT scan. Mostly x-rays are studied, and the structures based on this. So after that, applied anatomy. In applied anatomy, you will learn the clinical correlation. Now this anatomical knowledge, whatever you are learning in anatomy, how you will correlate all these things, all this knowledge to the clinical sites in your hospitals, like in your clinical practice, how to relate them. USG means ultrasonogram. Okay, ultrasonogram. Yes. So in applied anatomy, you just learn how this anatomical knowledge is correlated with the clinical findings, the clinical side. So this is just the applied anatomy. Like in anatomy, you will learn that the structure of spinal cord, everything, the structure of the vertebra, like T1 means thoracic one vertebra. That means T1. Okay. So this is an anatomical correlation that the spinal cord ends at the level of the thoracic one vertebra. Okay, so here we will do the lumbar puncture. So lumbar puncture is a clinical procedure. Lumbar puncture, why we do lumbar puncture? It is done by a big needle, then in the lumbar region of the, like where the lumbar vertebrae are present, in that region, that needle is pushed and some fluid is taken out. What fluid is taken out? Cerebrospinal fluid is taken out. Yes, so that cerebrospinal fluid is taken out to relieve if someone has raised intracranial pressure, like they have so much high intracranial pressure. So to that, to relieve that pressure, some fluid is extracted. How it is extracted? By the lumbar puncture. So if you just don't know where the lumbar region is, okay, where the spinal cord is ending, you will not be able to do the lumbar puncture. Maybe you are just doing it at the level of spinal cord, and you are injuring the like causing some injuries to the spinal cord. And if some injury, even minor or major injury, is done in the spinal cord, then that can lead to paralysis of the patient. So this is so dangerous, right? So the knowledge of anatomy is so important to become a good doctor. So when you are doing a lumbar puncture, then you will have a clear idea where the spinal cord ends, and after that the lumbar region will start, and in that region I will have to do the lumbar puncture, because we cannot injure the spinal cord, because that will cause paralysis. Let me take some questions. In C-section, what are you asking, Mariam? What is done in C-section? Spinal cord ends at thoracic 1, like ends at the level of thoracic 1, or like lumbar 1 vertebra. Here it is written wrong, not T1, sorry. Lumbar 1. It's a little bit of typing mistake, I'm sorry. Lumbar puncture, not necessarily, like patients who have some kinds of neurological disturbance due to raised intracranial pressure. Okay, So then lumbar puncture is done. Or maybe like when there is some neurological disturbance, like you will need to study that if the cerebrospinal fluid is a fluid that is present in the brain, like in our head. So when you need to study that to see any abnormality, like you want to check and if there is any abnormality going on inside the brain, why is he having that kind of neurological disturbances? So you will need to examine that cerebrospinal fluid to test for any abnormalities. Then you will do lumbar puncture, and then you will take out the fluid and you will examine it. So lumbar puncture can be done for many reasons, and also to relieve the intracranial pressure, high intracranial pressure. Lumbar puncture can be done. For many things, lumbar puncture is done. So for that, now we are studying about anatomy, right? So for that procedure, you will need to know anatomy properly. So I'm trying to like explain it to why we need anatomical knowledge for clinical procedures, not just lumbar puncture, so many other procedures, like even for drawing blood, like when you go and give blood, right? So if you just don't know where the vein is, if you don't know the anatomy of the vein, the structural placement of the vein, how will you draw the blood? Intracranial pressure, increased intracranial pressure. Let me write it. Intracranial pressure means the pressure of the brain. Intracranial, not intercranial. Okay, so this is all about applied anatomy. After that, experimental anatomy. Sometimes even experiments are done to understand the various structures of the body. So that is experimental anatomy. It's not that much practice. So next slide, please. Now genetics. Genetics is also something you will study in anatomy also and in biochemistry also. So you all know what is genetics. The study of gene is genetics. Okay, study of the hereditary and the structural and the functional composition of the chromosomes, the karyotypes. Karyotypes means like structural condition of the chromosome and like all these things. This is genetics. Okay, this is also a part of anatomy. And then comparative anatomy. Like comparative anatomy, it's just given in the name. When you will compare the structures of animals, various animals, to understand the processes of evolution, like functional differences, like there are so many differences between the anatomical structure of any animal and a human body. So this thing you will compare, this is the comparative anatomy. Either the things are similar or it is different. These things are comparative anatomy you will learn. Now physical anthropology, this is also a branch of like anatomy. So next slide, please. There are some other terms we will use and you will need to understand, like cytology. I told you earlier, even in the classes, that cyte means cell. Like whenever you will see the word cyte, it will mean cell. So the study, logy means study. So cytology means the study of cells. Ultrastructure of the cells under the microscope. When you will study any kind of cell, that means cytology. Then functional anatomy. Functional anatomy is like analysis or like studying the anatomy of the body according to the functions and correlating with the structures. And pediatric anatomy, pediatrics means relating to child. So anatomy of a child means pediatric anatomy, and anthropology, study of the joints. Next slide. Now, I told you earlier that we will be studying some organ systems, some basic organ systems you will know. The integumentary system means the skin and its appendages, the skin, nails, okay, hair. All these things comprise of the integumentary system. And then skeletal system means everything relating to the bones. Muscular system means muscles, all the muscles and everything. Nervous system means the nerves, the brain. Okay, nervous system consists of the brain, the spinal cord, all the nerves, sympathetic, parasympathetic nerves, autonomic nervous system. Okay, all these things. And then endocrine means relating to hormones. Okay, everything that is related to hormones is the endocrine system. Endocrine system will consist of the glands, because glands secretes hormones like thyroid gland, adrenal gland, okay, pituitary gland, pineal gland, all these glands and then what hormones they secrete, what are the functions of those hormones, what they do in our body. All these things come under the endocrine system. Okay, after that, cardiovascular system. You all know cardiovascular system means heart and its functions, then the structures of heart, functions like the veins, arteries, how it is distributed throughout the body, what it does. All these things comprise of the cardiovascular system. Now, lymphatic or immune system. Lymphatic is like there are some lymph nodes present in our body, and then some lymph channels. All of these comprise of the lymphatic system, that is known as the lymphatic system. Okay, and then respiratory system, the lungs, bronchus, trachea, all these things together comprise of the respiratory system and the functions of it. And digestive system, like the stomach, the esophagus, the functions of like the stomach, esophagus, the colon, transverse colon, descending colon, ascending colon, rectum, everything you will learn under this digestive system. Now is just primarily you are learning the systems, like, okay, there are these and these systems inside the body. Then details you will learn later on when you will go inside the detailed study of anatomy. Okay, and then urinary system to consist of the urinary bladder, the urinary tract, everything. And reproductive system, the male and female reproductive systems. Like in female reproductive system, there will be like vas deferens, epididymis, testes, all of these things. And in female reproductive system, there will be like the uterus, ovary, uterine tubes, or cervix, all of these things. So they come under this system. Next slide, please. Now, the anatomical position. What is the anatomical position? For every kinds of describing the human body, we need to fix a position. So when a person is standing erect, and then eyes will be looking straight forward, and their upper limbs. Okay, the upper limbs will be side by side, and the palm will be facing forward. Okay, palm will be facing forward or anteriorly. Like you will learn what is anterior later. Like palms will be facing forward, and the lower limbs will be straight with the feet forward. That is, toes will be facing forward. That is the basic anatomical position. So many of you are confused between left and right. Like you will think that left, right, all of us know left, right, but in anatomy, it's quite different, because in anatomy, many students makes this mistake in left, right, but left, right in anatomy is not what you are observing, not your left and right, but the person in front of you, whose anatomy you are studying. That person, when he is standing in the anatomical position, then his or her left or right is the left or right you will be writing, you will be understanding, you will be using in your viva and exams. Okay, that is the left, right. So this is the anatomical position. I hope you all understood, because knowing the anatomical position properly is very important. So here we have inserted a figure. So you can see that the eyes are looking forward, the palm, they are facing forward. Okay, palms are facing forward, and the feet is facing forward, toes are forward and standing erect. This is the anatomical position. So someone wrote T pose, not exactly this is T, because he's not like raising his hands on both sides. This is the anatomical position. Next slide. Did you all understand the anatomical position? If not, then please tell me, I will explain again. Now, there are some terminology we need to understand for anatomy. Like these terminologies are like needed in everywhere. When you will learn any viscera, when you will learn any bones, you will need to know what is anterior, posterior, superior, inferior, everything. So anterior means above. Anything that is above means anterior, or like superior. Anterior, superior means above, anterior means in front, I'm sorry, superior means above, and anterior means in front. Anything that is in front is anterior, like near to the front of the body is anterior. And when you're going to learn embryology, in embryology, this anterior means ventral. Okay, so anterior also means ventral. That is, front of the body means anterior, back of the body means posterior. And in embryology, we use the term dorsal. So posterior or behind or back of the body means dorsal, and anterior means in front, and then superior means above. And in embryology, superior means cephalic, above. Okay, near to the head, anything near to the head, it means superior, and inferior means below, like closer to the foot, that is inferior. And in embryology, we use the term caudal for describing inferior. Next.